If you've tried resolving back pain through exercise and found that it just leads to more pain, either in your back or in a hip or a knee or even a shoulder, then this one is for you. But first, the disclaimer. First, let me commend you on taking matters into your own hands regarding the health of your back. If you've tried exercise, that means that you've likely had good medical care first, chiropractic or physical therapy, something like that. But then you realize that if you didn't continue to actively work on your body, the pain would return. And you're right about that. The problem is the type of exercise you used. Now, before I go on, let me just say that I was right where you are only a few years ago. I realized I had a back problem, a chronic back problem that came back every time I would ski or go for a run or ride my bike a long distance. And that's when it dawned on me that I needed to do something active after discharge from physical therapy, use some kind of targeted exercises to help my back. So I did what I knew to do. I went to the gym and I tried every type of strength training I could find. Circuit training, TRX, kettlebells, you name it, I did it. But still the pain would return. And sometimes it wasn't even in my back. Sometimes it was somewhere else, like my shoulder. So now what, I was thinking, just like you probably are now, I'm hurting something else? What I had to learn, and what I want you to know, was that my training wasn't injuring me exactly, but it wasn't giving me what my body needed to move forward from my back problem. You see, when you have back pain, your nervous system acts like a giant switchboard, and it starts unplugging some muscles, like the ones that are closest to your spine that control motion there, and then it causes other muscles, some of your outer muscles, hip flexors, low back muscles, to grip. All of this in an effort to protect you and prevent further injury. The problem is that, as you can imagine, this gives rise to muscle imbalances. And muscle imbalances mean that you're not going to move efficiently. So that means that as you're moving, especially if you're doing repetitive movements like strength training with these muscle imbalances, you can cause extra pressure to build up in any given area. It might not even be in your back, and so you start to experience new pains. It's not exactly that you're creating new injuries, it's that you never finished addressing the back problem in the first place. The good news is you can avoid all of this. You simply need to address the muscle imbalances by reprogramming healthy movement, healthy, efficient movement at the nervous system level before you resume fitness training. And yes, you will resume fitness training. You must resume fitness training because a healthy, strong body is one way to prevent future back injuries, right? Now, to learn how to do exactly this, to learn how to rebuild those healthy movement patterns at the nervous system level, click on the link in the description below to save your seat for my next free live online workshop where I'm going to tell you all about how we do exactly that. All right, save your seat and I'll see you there. Until next time, keep moving and be well.